All right, so this is Ambulatory Surgery Centers, module number 1. We have Corrine, Wendy, Lindsay, Kristen, Jonathan, and Amanda in this group. Now, the first question that we had was, what are the origins of the ASC phenomenon? When did it and where did it start, and who were the founders? The first ambulatory surgery center was opened in Phoenix, Arizona in the 70s by 2 doctors who were looking for a solution for scheduling conflicts in the operating rooms. Dr. Wallace Reed and Dr. John Ford were the doctors that pioneered the ASCs. The frustration that they felt due to scheduling conflicts and competing OR times and the red tape that they had to cut through led them to this new idea. So there are many economic factors that motivated the ASC. Hospitals charge an arm and a leg, literally, for any kind of procedure that you have done there. ASCs cut down on the excessive costs. They save an average of $2.6 billion a year, Medicare does, by sending patients to ASCs to have procedures done. Ambulatory surgery centers just allow for a more streamlined billing process. It decreases the financial burden on patients. A few non-economic factors that motivated the ASC movement are, like I mentioned before, the frustration between doctors and patients having to wait to get their OR time scheduled. Something that allowed for better patient care was more efficient procedures and streamlined processes that the ambulatory surgery centers offered. Also, another one was less exposure to different germs that you would have in larger hospital settings. Cuts down on the illnesses and after procedure sicknesses that can occur from staying in hospital long term.
Go ahead, slide 4.
That's me, sorry. I think, right, am I 5 still?
Mm-hmm.
Okay, benefits and advantages for patients by being treated at the ASCs. Their out-of-pocket costs are lower. Their care is tailored to them because the setting is smaller. Less dependency on available hospital beds. Elderly and children prefer these settings because it has a less hospital-like atmosphere. And there's less pre-op testing and preventative medications that are necessary when having procedures done at an ASC.
This is me. Briefly describe the conditions of participation state regulations that govern the establishment and licensing of an ambulatory surgery center. Ambulatory surgery centers cannot be inside a physician's office. It must have a separate entrance and waiting area. Surgery centers are not licensed for inpatient beds and may not keep a patient longer than 23 hours. And they must have a transfer agreement with a close-by hospital so that patients who experience difficulties or require inpatient admission for higher level of care after can stay and recuperate longer than 23 hours to the ASC and to a hospital with which they have the transfer agreement. Must an ASC be certified? How does that happen? An ASC must be certified by Medicare to perform cases for Medicare patients. ASC must comply with standard developed by the federal government for a specific purpose of ensuring the safety of the patients and the quality of the facility, physicians, staff, services, and management of the ASC. The ASC must demonstrate compliance with these Medicare standards initially and on an ongoing basis. 85% of ambulatory surgery centers are Medicare certified. However, they are not free to perform all procedures Medicare allows in hospital outpatient departments. And 42 states require licensing. Each of the states has their own requirements that have to be met for licensure. Most state programs require rigorous initial and ongoing inspection and reporting. And 1/4 of ambulatory surgery centers are accredited by one of 4 accrediting bodies. What is the OPPS and how does it apply to ASCs? OPPS is the Outpatient Protective Payment System. The Outpatient Protective Payment System is the payment system for set rates under Medicare Part B for hospital outpatient services. ASC payment system is the payment system for set rates under Medicare Part B for ambulatory surgery centers. ASC payment system and the OPPS are regulated together. And what are the most frequently occurring types of ambulatory surgery centers? So the first graph that I have there are the types of procedures that are performed in the ambulatory surgery centers. And the second graph shows the percent of ambulatory surgery center by specialty for that. Did I skip one there? Okay, no, yeah. Sorry. There we go.
Okay, so how do not-for-profit and for-profit business models affect ASCs? Most ASCs are owned and ran by physicians and hospitals. Due to this, there's no big majority of ASCs that are affected by for-profit businesses, and they are not really affected by not-for-profit businesses since all ASCs have to have an income. Identify the features of ASC business model that are attractive to physicians. So a lot of physicians love ASCs and working in them. Most are owned by the physicians, and so they have control over their staff and the amount of incomes that go towards their staff. Physicians also have more control over scheduling and can see more patients in shorter amounts of time. They also choose to work in ASCs because it benefits financially from procedures that they perform in an ASC more than they would in a hospital setting. And when physicians are linked up with hospitals and owning an ASC, there's a higher chance of physician performing on someone who goes to that certain hospital due to the hospital recommending them. Outline the departments and functional components of an ASC. Trace the flow of a single patient from pre-admission to departure. So first, the patient goes to the ASC and gets registered. They then change into a gown and is introduced to their anesthesiologist and is administered their medications. Once the surgery is completed, the patient has recovered from their anesthesia. The patient then goes through phase 1 recovery, which allows them to be awake. Phase 2 recovery consists of when the patient can have their families in the room and they are monitored until they are ready to leave. And then the patient departs from the ASC and goes home to rest. Describe ASC reimbursement and differentiate it from hospital reimbursement. ASC bill using cost per treatment, where hospitals use line item billing. ASC reimbursement is based on general inflation and is not healthcare specific. ASC reimbursement is based off of Consumer Price Index. And in 2008, the surgery centers received over 75% of hospital reimbursement. And in 2012, that percentage went down to 56%.
So what is a transfer agreement? A transfer agreement is there in case there's any type of emergency in the operating room, in the recovery rooms, or if a patient needs to be there longer than 23 hours. As was said, they can't keep anyone over 23 hours. The transfer is usually done through ambulance services unless they're connected with an inpatient facility. They are required to have this agreement in place in order to be certified for Medicare or Medicaid patients. A couple of interesting points are that it is a requirement for accreditation from the Joint Commission, and the physician who performed the surgery needs to have privileges at the hospital to oversee the patient's stay. So what is CASC and how does it apply to ASCs? CASC stands for Certified Administrator Surgical Center. It is an additional specific credentialing for administrators of surgical centers. Others in the surgical center may also get this credentialing, such as directors of nursing, medical directors, and other clinical staff. By having this extra credential, the administrators are able to have a fuller knowledge of the industry and enhances their distinction within the ASC industry. And BASC is the only credentialing organization for CASC. So are ASCs accredited? No, they don't have to be, but it's recommended. Approximately 25% of all ASCs are currently accredited. There are a couple of different organizations for the accreditation process. In order to see Medicare and Medicaid patients, they must be certified, but not necessarily accredited. Currently, 85% of all ASCs are certified. So the most expensive single expense item for ASCs are implants. That's anything that's left inside the body during a surgery to repair, replace, or improve the function of the body, such as bone, cartilage, pins, screws, plates, anchors, pain pumps, radioactive seeds, etc. Says that implant reimbursement has become a sensitive in contract negotiations because implants are an unpredictable cost to the payer. Frequently used in orthopedic, neurosurgery, and hand surgery, implants costs will continue to increase until some implants come off trademark. Many implants will continue to be expensive, and managing their costs is a major concern for ASC administrators and managers.
Okay, we have talked about some of the factors that motivated Madison Memorial Hospital to acquire North Fort Surgical Center. Describe the advantages to both parties, like the physician owners and the hospital. Well, first, by operating in ASCs instead of hospitals, physicians gain increased control over their surgical practices. In the ASC setting, physicians are able to schedule procedures more conveniently, assemble teams of specially trained and highly skilled staff, ensure that the equipment and supplies being used are the best suited to their techniques, and design facilities tailored to their specialties and to the specific needs of their patients. Physician ownership allows for maximum professional control over the clinical environment and over the quality of care delivered to patients. As a result, patients say they have 92% satisfaction rate with both the care and services they receive from ASCs. This enhances the delivery of care by allowing physician to focus exclusively on a small number of processes in a single setting, rather than having to rely on a hospital setting that has large-scale demands for space, resources, and the attention of management. Afford patients the ability to bring any concerns directly to the physician operator who has direct knowledge about each patient's case, rather than deal with hospital administrators who almost never have detailed knowledge about the individual patients or their experiences. And physician ownership helps reduce frustrating wait times for patients and allows for maximum specialization and patient-doctor interaction. Exercise better control over scheduling so that no procedures are delayed or rescheduled due to the kinds of institutional demands that often occur in hospitals, while allowing physicians to personally guide innovative strategies for governance, leadership, and quality initiatives. What legislation specifically pertains to the way that ASCs are owned, managed, and operated? ASCs are some of the most regulated healthcare facilities in the nation. Each ASC must comply with a host of laws and regulations on both the federal and state level. These rules cover all aspects of ASCs, from their day-to-day operations to how they are paid. Most ASCs provide care to Medicare beneficiaries and thus must meet federal government requirements and demonstrate continual compliance with Medicare standards. There are additional federal laws all ASCs must comply with, such as health insurance portability and HIPAA. In addition, ASCs must meet specific requirements and obtain a state license in virtually every state. Here's an example. Here are 10 recent legislative updates for ASC. A Pennsylvania senator has introduced legislation that would limit the insurance company's retroactive reimbursement denial so payers aren't able to take away reimbursement 12 months after paying the initial claim. The Centers for Medicare and Medicaid Services extend their deadline to finalize a rule under the Affordable Care Act that requires providers to report and return overpayments to Medicare. The extension is for 1 year, and the proposed rule would look back at paid claims for the past 10 years for overpayments. Ambulatory surgery centers must report healthcare personnel influenza vaccinations summary data to the National Healthcare Safety Network by May 15th to qualify for the Medicare ASC Quality Reporting Program. This is one of 10 quality measures. The Supreme Court is ruling on King v. Burrell, which challenges healthcare reform's authorization of federal tax credits for low and middle-income individuals who purchase insurance on the exchanges. Eliminating the tax credits would mean more uncompensated care with less spending on hospitals, physicians, and pharmaceuticals. CMS revised guidance on the State Operations Manual for ASC surveyors, clarifying the physician discharge order requirements for ASCs. Operating physicians are able to write a discharge order indicating the patient may be discharged when stable, instead of requiring patients to leave the ASC within 15 minutes to 30 minutes of the time physicians sign the discharge order. President Barack Obama's 2016 budget was released earlier this year and aims to save $423 billion for Medicare from 2016 and 2025. The budget would repeal the sustainable growth rate and lower off-campus HOPD rates to physician fee schedule or ambulatory surgery center rates. The rate change is estimated to have a $29.5 million impact from 2017 to 2025. The U.S. Court of Appeals for the Seventh Circuit expanding the definition of referral under the anti-kickback statute, which puts some arrangements that were previously considered safe in danger. In U.S. v. Patel, the court concluded an illegal referral occurs when a physician either directs a patient to a particular provider or allows patients to receive care from that provider. A new bill that is titled the American Liberty Restoration Act was introduced to Congress to overturn the Affordable Care Act's individual mandate. This is the first bill introduced by a Senate majority party to overturn the individual mandate. A Michigan representative introduced a bill that would prohibit health and medical malpractice insurance issuers from engaging in anti-competitive activities. The sign up for healthcare.gov was extended in 37 states until tax season after 800,000 health insurance enrollees received incorrect tax information. What is a licensed recovery center?
Sorry.
This is a facility which has a distinct organizational entity, an organized medical staff, nursing service, and a range of rehabilitation services, which provides progressive levels of functional rehabilitation services to persons who require diagnosis and treatment for non-acute chronic injury, illnesses, or other disabilities. This excludes substance abuse, mental and/or rehabilitation facilities licensed by any other state agencies.
What technological advances have influenced the growth and popularity of ASC? Laparoscopic procedures reduces surgical time and lowers infection rates and less need for wound management. Hardware used, the improvements have made it so that the hardware equipment like fusion screws and better plates, regional and localized anesthesia have helped the advancement of ASCs, and then laser surgery. The advocacy organization for ASCs is Ambulatory Surgery Center Association. Their mission is the Ambulatory Surgery Center Association is a national membership association that represents ASCs and provides advocacy and resources to assist ASCs in delivering high quality, cost-effective ambulatory surgery to all patients they serve. The current trends in ASCs, first, expanding the coverage that is offered to at the facility, not being just specialized in one particular surgery, but offering a wide variety of procedures. And then enhancing the patient's experience, making it run more smoothly and more friendly to the patient, and then being more energy efficient so that the facility itself can be self-sustaining and not need energy from outside. And then another trend is that Medicare is opening up more procedures that can be done at ASC. Challenges facing ASC administrators. Large health systems are acquiring the physicians, and so less physicians are doing surgeries at ASC. Out-of-network issues with insurance, negotiation of contracts when surgeries are not Medicare approved list, recruitment of new physicians, reimbursement from insurance companies, low volume when the physician gets employed by a hospital, and then continued decrease in reimbursement amounts as the cost of doing business is rising.
So there are 5 main components that are focused in the CASC exam. They are delivery of patient care, quality management, human resources, financial and business development, and regulatory and legal issues. Those who administer it are BASC, which I talked about earlier, which stands for the Board of Ambulatory Surgery Certification. It's a nonprofit organization founded by FASA, which is the Federated Ambulatory Surgical Association.
What key indicator for you to monitor as the administrator of an ASC? Reimbursement and revenue cycle, which includes billing and receipt of payments. Make sure that those, the revenue cycle is happening in a timely manner. Profitability, including scheduling, supplies, case costs, and human resources. The facility is scheduled to maximize profit. Supplies are purchased at the best price point. Case cost is review case cost to be sure that billing is being done appropriate fees are being billed for the services. And human resources, monitoring employee pay, credentials, and hours worked. And then regulations, which we make sure that you're up to date on accreditations and Medicare certification. briefly describe the profitability of the ASC segment of the industry. Key points for enhancing ASC profitability and work are scheduling, business office, clinical areas, case costs, and supplies, human resources discounting.
Describe the politics of ASC development, ownership, operation, and performance. So with development, the ASC development program has 5 phases. The first one is strategic and economic feasibility assessment. The next one is facility design and development. The third one is project management. The fourth one is equipment selection. And the last one is licensing and certification. With ownership, MDs have shown ownership since day one, but within the past 10 years, hospitals have started to own ASCs. So now it is common for an ASC to be owned by a hospital and a physician. With operation, the ASC industry has regulations and standards when it comes down to operations. And these regulations ensure safety and the best care for patients. And with performance, there's a requirement for an ASC to go through external benchmarking, giving the facility a chance to compare their performance to other performances of different ASCs. If you were to desire to become an ASC administrator, what educational and experiential background and what professional and advocacy organizations would be helpful? An ASC administrator would have to be educated. They would have to obtain a degree in healthcare administration. They would have to have experience, such as an internship or job shadowing. They would have to show good communication with MDs. And then they would also have to demonstrate an employable skill that could lead to obtaining important responsibilities. And an advocacy organization that would be helpful is the Ambulatory Surgery Center Association, the ASCA. And being a member of the ASCA provides members with benefits and services, enhances ASC representation at federal and state levels, assists state ASC associations, and combats legislative, regulatory, and many more challenges at the federal and state level. Why would it be useful to understand physicians and their motivations? It would be very useful to have the knowledge of the motivations that physicians have for anyone. Things that motivates physicians to work in ASCs include having control over their environment and the care of their patients, having the ability to be more productive, having the control over quality due to a smaller number of operating rooms and smaller space. Sometimes they have an increase in income, and there is way less hassle with working in a hospital. With these motivations in mind, it is important for us to know that physicians working in an ASC have the drive to perform surgeries to the best of their ability. And that is our presentation. We hope you liked it.